Hi, it's Roberto Mickey with your COVID-19 update for Miami-Dade County on November 16th, 2020. Sorry for the delay in this video, but Miami-Dade County just published their data around 9:40 p.m. tonight, and so I'm making this a little bit late. I'm not saying anything, but it might have been all those emails everyone was sending to Governor DeSantis yesterday. In any case, everyone keep up the work because I think Miami-Dade County still needs independence. So I'm going to be showing some analysis that I performed looking at the national and the Florida data. If you look at this graph, this is a graph of the number of cases nationally. And what you can see is that the cases have had 3 peaks. And interestingly, this is another graph with deaths, and deaths have not correlated with cases. Most people have attributed the fewer deaths that we're seeing now than we did early in the pandemic is that the healthcare systems know how to better treat this. There are better medications. There's a different population who's getting infected. Younger patients are getting infected, and older patients, more susceptible patients, are avoiding the infection. And some have suggested, maliciously or otherwise, that deaths are not being reported. But I think this is unlikely. Here are the graphs toggling back and forth, and what you can see is that the cases are about 3 to 4 weeks before the deaths, and they correlate reasonably well, at least as far as timing goes. But you can definitely see a improvement in the death rate. Now when I saw this, I thought there's probably going to be a similar data here in Florida. So here's the graph showing the number of cases or new reported positive tests in Florida. And what you can see is that we had 3 waves. Essentially a first wave, a second wave, and a third wave. And obviously our second wave was bigger than our first wave, and hopefully bigger than our third wave. And here's the graph with the deaths for the state. But interestingly, our graphs don't match and don't necessarily correlate. Here are the graphs sort of toggling back and forth every half second, and once again, I just don't see where they're correlating or the pattern is being consistent. Something doesn't quite add up. And if the healthcare systems know what they're doing, there's better medication, and we have a different population getting infected, then our death rate should be lower. But for some reason, our death rate is still elevated. So one theory I came up with is that perhaps some of the positive tests are not being reported, or that testing is not as available as it should be in the areas of the state where the pandemic is growing. There are probably other reasons why this could be happening, and hopefully one of the viewers will make a comment, or someone who knows more about statistics can actually figure out why this is the case. Another thing that I've been meaning to do is to look and compare influenza to COVID-19. So this is the influenza data from the CDC website, and basically it shows that the influenza death rate is around 0.09% per infection. And this is the COVID-19 data that I got from both Florida and from the US numbers, and we get about a 2% death rate per positive case. And if you estimate that there's about double the number of infections because 50% of people are asymptomatic, then you get about a 1% death rate. So that means that COVID-19 is about 10 times more deadly than influenza. So similarly, I wanted to look at the hospitalization rate and compare influenza to COVID-19. And I looked at the 2018-2019 influenza season, and we had a 1.4% hospitalization rate. And for the COVID-19 data from Miami-Dade specifically, from the months of 6/26 to 9/26, we looked at 138,000 positive tests, and we had about 9,900 admissions, which calculated to about a 7% hospitalization rate. And even if you double the numbers for the number of patients, because we have 50% asymptomatic, that's only a 3% admission rate. So still, influenza is about 3 times less problematic than COVID-19 as far as hospital demand. So using this information, I tried to predict what would be the positive test rate that Miami-Dade could sustain and tolerate for a long period of time. And basically at 3,000 positive tests per day, we will fill half the hospital beds in Miami-Dade County within 10 days. But at 1,000 positive tests per day, there's kind of a sweet spot right there where I think that we could easily sustain this because we'd only have about 700 admissions every 10 days. Obviously, less positive tests and less admissions is better. But if we're going to tolerate a certain number, then 1,000 is probably that number. But this is assuming a lot. Number one, it's assuming that the average patient stays only 10 days and that the percentage of patients being admitted to hospitals stays at 7% per positive test. I'd like to thank Shane Zamani out there because he made me really question my own thinking and logic behind this whole process. And that's what made me go and look at these numbers and try to calculate what would be a reasonable rate of positive tests per day for Miami-Dade County. And I think that 1,000 rate is probably the number. But obviously we need to keep a close eye on this, and this is a moving target and whatnot. Either way, I still stand by my thinking that we as Miami-Dade County deserve the ability to govern ourselves in this county, especially in reference to this pandemic. We have a higher population density and we have families with multi-generational homes. This makes Miami-Dade a different situation than the rest of the state. Regardless, everyone should be wearing a mask, washing their hands, and practice social distancing, and we'll get through this. The great news is that both Moderna and Pfizer have had really good results so far in their trials, and hopefully we're not far from an approved vaccine. Miami-Dade County has 577 admitted patients currently. There were 996 positive tests yesterday in Miami-Dade County, with a percentage of positive tests being 7.53% and the 14-day average being 7.70%. Once again, this Sun Sentinel article demonstrates that we may need to take these numbers with a grain of salt, as they may be actually worse than what is published here. The number of newly admitted patients was 78, and admissions outpaced discharges 78 to 52. The number of ventilators is still quite good at 560, but slightly lower than our average previously. This is the MiamiDade.gov website giving information on the data from Miami-Dade County. And this is the Broward County website giving similar data. And this is the Washington Post website with some of the graphs that we used. Everyone out there, stay safe, wear a mask, and if you like this video, hit the like button and hit the subscribe button and help out the channel. Thanks a lot.